I was in Taiz for the month of November, which we had a large increase in fighting in the area, which meant we had, for example, on the 17th November, across both the Enclave and Al-Hoban area, a total of 76 wounded and 21 killed. For that particular day, it's a day that I don't think I'll ever forget. Possibly one of the most horrible days of my entire life, but also one of the most inspiring. So I was acting project coordinator at the time, so I was responsible for managing the mass casualty response that we had to deal with when there was a blast at a local market. So these are people who have gone out to buy something. It happened at 7 o'clock in the evening, so after work hours generally, people were milling around and a shell hit. So we first received reports that the blast had hit the market. Then as the security responsible, I had to verify that there was no ongoing shelling in the area so that we could actually respond. So when we clarified that the shelling had stopped, we then sent our ambulances to pick up the wounded and transport them back to our trauma center, and also to see how the level of casualties were and to see how we would respond. It became very quickly apparent that the trauma center that we had was overwhelmed, so then they had to refer patients to our mother and child hospital where I was based. So although we sent ambulances to the blast, we were at this point receiving people in the back of pickup trucks, in other ambulances, in the small little vans that are very prevalent in Yemen. And this is when things got very intense. The logistical team, which I was in charge of, was responsible for making sure that the ambulances were moving to go to the blast site to go pick up the wounded, trying to manage security because obviously because it's a very tense situation, you will have people with weapons who are trying to come into the hospital. Maybe not irate, but also we have our principles that we say there's no weapons allowed in the hospital, which can be difficult if the situation is very tense. So they were trying to manage that as well, and just trying to facilitate the medical team as much as possible, moving people in and out of ambulances, creating a temporary morgue that we had for the people who had passed away.